Well, the Ministry of Health and Social Services is participating in the annual #MedSafetyWeek campaign 2022 under the theme, How Patients and Healthcare Professionals Make Safety Work. Now, the day will run until Sunday, the 13th of November. And joining us in studio, we have invited, that is the Acting Deputy Executive Director at the Ministry of Health and Social Services, Dr. Theo-Ben Kandetu, as well as Medicines Information and Safety Pharmacist at the Therapeutic Information and Pharmacovigilance Center, Ms. Frieda Shigwedha. A very good morning, ladies and gentlemen. How are we doing this morning?
Fine, thanks, and you?
Good to have you. I'm so excited to learn about the campaign and about co-vigilance and so much here this morning.
We're happy to be here.
Great.
Thanks.
Right. So I think let's start off with the #MedSafetyWeek. We've established it's an annual event. Talk to us about this event and why it was established.
Okay, so the #MedSafetyWeek campaign is an international and social media campaign that runs annually, and it has been running under the WHO International Drug Monitoring Center. So this campaign runs on an annual basis, and then it's focused on various themes. And the theme for this year, as you've mentioned, is that we try to have the healthcare professionals and the patients work together to make safety work. So this is the safety of medicines. And the focus of the campaign is two things. Number one, to encourage reporting of the side effects that occur as a result of taking medicines. And number two, to raise awareness on the pharmacovigilance. Pharmacovigilance is basically medicine safety. So it takes two to tango. We need the healthcare professionals, and then we need the patients as the biggest client. So the Ministry of Health is also part of this campaign, and yeah, we do this for the country.
That's good. That's good. Let's now talk about the pharmacovigilance. I'm really happy that you sort of, made that very, very clear for us in a very, in layman's terms for, us and so on. Let's talk about ADRs as well. I think I'm going to stay with you, Ms. Shigwedha. What are the ADR systems, if we're talking about that?
Okay, so the ADR stands for adverse drug reactions. So then the systems that are in place for that is what we call reporting, which forms a significant part of the medicine safety cycle. So what happens is you have a patient who is on a certain drug, and then after some time they're experiencing certain side effects which may be producing some undesirable effects. And this is where the monitoring comes in now, where the patient goes back to the doctor or the healthcare facility and says, I'm experiencing adverse drug reaction or the side effect from this medicine, and therefore I would like some advice. And this is where now the healthcare professional comes in and jots it down and makes a note of it. And this is the reporting part. So the patient actually has to come. And then
of course, report.
Yes, to report.
So, Doc, this is what I want to ask you now. So what role would healthcare professionals, or, the importance of the role of a healthcare professional in playing and promoting the recognition of reporting ADRs?
Yes, many thanks again for having us. So as has been highlighted already, healthcare workers are a very important stakeholder in all of this. What's important is, first and foremost, they need to themselves be aware that these initiatives exist. As we've said, although this is an annual campaign that right now we are doing for 1 week, the engagement between the Ministry of Health, specifically the NMRC, the Namibia Medicines Regulatory Council, with healthcare providers, with healthcare facilities, happens year-round. So it's important just to underscore that. What healthcare workers can do, how they can get involved, is number one, to share the materials that have been made. We've spoken a great deal already on other platforms about the various materials that are out there under the campaign. It's essentially a social media campaign. So we are looking at platforms like WhatsApp, like YouTube, like Facebook, like Instagram, and others. So it's important to know that healthcare workers recognize that there's an initiative like this that exists, that they share the materials that are on our various platforms, where there's a Ministry of Health website, where there's a Ministry of Health media page on social, on Facebook. They can share this information on their own media pages, whether it's their personal media pages or their professional media pages. They can share this information with their associations, for example, if they belong to medical fraternities or associations, they can share that on there. And as Frieda has highlighted, most importantly, when they are engaging with their patients on a one-to-one basis, they can use this information, this material, to have this discussion with their patients.
Okay, good. So we're really trying to bring this information to the people. Okay, fantastic. So what would you say are some of the factors that could possibly negatively affect reporting on ADRs?
Okay, so one of the factors is probably the lack of awareness, and this campaign is just another avenue for us to say we are here. This is a process that is possible. You can report. Sometimes a headache is not just a headache, you understand, and to say that there is a door that you can knock on. So sometimes people are just not aware. If you don't know something is available, then you won't make a use of it. Also, so that's why we're trying to bring in or trying to rail in the public to say that as the patient, you are the most important client. We can't talk about healthcare and exclude them. So I believe that at this point in time, it's awareness, and that's why we're really harpering on the social media, but it's just one of the avenues. Otherwise, as Dr. Kandetu said, that it runs throughout. It's part of our mandate and our responsibility to the Namibian people.
Okay, great stuff. Because I like to also backtrack a lot. So we said this is an annual campaign. You've had a few before. So if we took a bit of notes from, let's say, the last couple of years, Doc, and Frieda, you're welcome to engage on this as well. How, in terms of where we were and how it's going, how would you guys say, what's the status on that?
So I think if I can ask, I think, you know, the good thing about campaigns like this is it creates a massive platform, and especially in the age we are living now, where we have access to information very, very freely because of the internet. So because of platforms like the internet, like the social media pages like Facebook and Instagram and what have you, we have seen with every single campaign over the last years that there is an increase in awareness of adverse drug reactions amongst healthcare workers, but also importantly amongst the patients. And because of that, we've seen an increase in reporting. So I think it's campaigns like this that really help us to get the message out there, to make sure that we improve on medicine and patients' safety.
I just want to add on to say that looking at where we were before and where we are now, moving along with the digital times. Before, the healthcare facilities only used to have access to what we call a safety yellow form. This is the adverse drug reaction form, which you complete on site. It was available mainly only on a hard copy. So it made it very difficult to have the patients always, especially those that are staying in rural areas or very far from healthcare facilities, to be able for them to always have to go to a healthcare facility and actually report the ADR and for the healthcare professional to fill the form in. Whereas now, with the digital times, we actually have access to an e-reporting link that is accessible to healthcare professionals and the patient. So you can sit in the comfort of your home and fill out this form, and it has sufficient questions that you can also answer and pointers that you need to fill in, information that it requires of you in order for us to be able to make an assessment of what you've reported, so that we can really find if there is an association between the drug that you've taken and the side effect that you are experiencing. So we also want to promote this e-reporting link, especially for the digital age. It just makes sense. But the conventional hard copy form is still available.
It's optional.
Yes, absolutely. But then with this e-reporting, it sort of caters to the new age. So yeah, that makes it a bit simpler.
Fantastic. I just wanted to find out, Doc, so if I were to be reacting to a certain medication, like if I were to be, is it because I didn't know I was allergic to something that was in the drug? Or how does this usually happen?
So, I mean, it's important to note for starters that it starts with the prescriber, right? It starts with whether it's the nurse or the medical doctor who is prescribing. So they usually know the side effect profile, and based on the disease profile of the patient, based on the symptoms that the patient presents with, they will pick the drug that is most suitable to them. But we know that most drugs have adverse reactions. Most of them are mild. So it's important for the prescriber, whether it's a nurse or the medical doctor, to be aware of that and to inform the patient of that, so that when the patient experiences those symptoms,
yeah.
they are aware and they can link, okay, fine, this is what I remember the nurse or the medical doctor informing me of, and therefore I need to go back to them and report it.
Okay, thanks for that clarity, Doctor. Yeah. So as we wrap up this conversation from the both of you, Dr. Kandetu, Ms. Shigwedha, or rather Shigwedha, I beg your pardon. No, so I just wanted to say also, with that closing off, how can people get involved now with MedSafetyWeek? As we wrap up, can you just talk to us about that?
Okay, so we have had the campaign materials and we've disseminated it to various institutions, even outside the Ministry of Health. So this is also inclusive of tertiary healthcare institutions, also professional associations as well. And then also the Ministry is also sharing this information on all their social media platforms. So what I believe in is the power of information sharing. So I have a broadcast list on my phone. You understand? So every morning I post something about med safety, and then my contacts, they post. So, you know, I inform you, you tell 10 other people, the 10 other people, and it goes and goes and goes. So that's how they can get involved. And whenever they post anything regarding med safety, they should just hashtag MedSafetyWeek, you know, just to say that the digital platform is there for that. I mean, you wouldn't use hashtag in a form or on a hard copy paper, but yeah, that's important. And then also just to say that the monitoring, that's the key. You can, like Dr. Kandetu said, it starts with the prescribers and informing the patients beforehand, but then there's also the post-treatment. And the monitoring is important to assess your patients, to really lend a listening ear and find out, okay, taking this medication, how do you feel? What are you experiencing? So healthcare professionals should also really engage the patients, but patients also shouldn't shy away from approaching the healthcare professional. So I think that's important. It takes the two.
To tango.
Yeah, to tango, yeah.
Absolutely. Thank you so much. Doc.
Thank you.
Yes, I think, you know, as has been said, although this is a week-long campaign, we have been, you know, engaging with healthcare providers year-long, every single year on medicine safety. It is well aligned with the mandate of the Ministry of Health on medicine and patient safety. So what's important here, and what I would like to say is that in as much as it's about creating awareness on adverse events, on side effects of drugs, it is also about creating awareness about institutions like national pharmacovigilance centers like the ones we have under the Namibia Medicines Regulatory Council. And it's also about ensuring that whether it's members of the public or whether it's healthcare workers or healthcare facilities know that these institutions exist. And it's about linking them up to these institutions. So if they would like to know more, we've heard you know, about the digital spaces where they can get involved, but if they don't have access to internet, for example, or access to digital platforms, we do have a number that they can call. This is the Therapeutic Information and Pharmacovigilance Center. They can call 061-203-2406. Again, the number is 061-203-2406.
Dr. Kandetu, Shigwedha, thank you so much for being here and all the best with your campaign.
Thank you so much.